Hello everyone. We are going to do our second video for chemistry specifically. This one is going to be covering your Alternative Medicine 2 PowerPoint that you have to review for today, Thursday, March 26th. Just a few things I want to remind you. These are YouTube created videos, so I can actually see how many people are watching these, and I know how many people I have in class. So we should have that same amount of views on each video, and for some of them we don't. So you guys need to be viewing these. You need to be viewing your PowerPoints. You need to be reading your chapters, and all of that. So just keep in mind, I can see who is viewing and not viewing. So we're going to jump into the second PowerPoint for alternative medicine, and this one is going to start off focusing on herbal remedies. So even though herbs are natural, we must know how they interact with over-the-counter drugs and prescription drugs. So if you think about, people are free to choose what they want to put in their bodies. A lot of people do use a natural and herbal route. But when they get prescribed prescription medications, so many of these herbal preparation or natural supplements do interfere or do interact with the prescription and even the over-the-counter medication. So, for example, St. John's wort is a natural supplement that is used a lot. It has many different things that it's recommended for use for. One of them is for depression and anxiety. It works really well in that aspect, but it interferes with almost every single drug on the market. So this again is another reason why it's so important for us to get the whole picture when our patients come to our counters. If you're a technician working in an ER and you're tasked with getting, patient history information for medications, these are the questions that you're asking them. Do you have allergies to any medications? Are you currently taking any medications? Are you currently taking any over-the-counter medications? Are you taking any supplements? And give them examples of what these are. Supplements, we're talking about vitamins and minerals and herbal supplements, these type of things, because you have to be very specific with your patients and ask very specific questions for them to kind of understand and comprehend what it is exactly that you're asking for. So the FDA does not regulate herbs because they are considered a nutritional supplement, and the FDA does not regulate those. Now, that does not mean that the FDA will not step in if there's herbal supplements being sold and there's conditions or people are dying or anything like that. The FDA will step in. For example, there was that little tea shop in San Francisco that was selling a type of tea that was made from a particular bark of a plant that, if it was not brewed properly, was extremely poisonous, and they had a lot of deaths associated with that, and the FDA stepped in and shut it down right away. They didn't shut the facility down or the little tea shop, but they removed it, and they don't allow it to be sold on the market anymore. So aloe vera, living in southern Arizona, we actually have aloe vera all over. It's a very nice succulent. It's very heat resistant, doesn't need a whole lot of water, and they're pretty nice little succulent plants. So aloe vera has been around obviously for a very long time, and it's been used through the ages for different things. Think about what you put on sunburns, right? That is aloe vera. The compounding lab Tammy had you do just before we went online with making the hand sanitizer, that's aloe vera. So we use it to treat burns. Some people use it to treat acne and other skin irritations. It can also be taken internally to be used as a laxative or to treat bleeding ulcers. So you can find aloe vera in an oral version, typically in a juice or even some capsules. And overall, it does come in gel, powder, capsules, tonic, and a juice. I've never tried it, so I don't know what the taste is like, but a lot of people do use it for various reasons. Black gohash is used very commonly for hormone replacement. They can also use it for rheumatism and cough. So as bug bane, which is another form that they create using the particular plant. It's actually used as an insect repellent. So black cohosh is used a lot. It's one of the kind of the first go-tos for the naturopathic doctors that are treating particularly females of menopausal age. They'll have them start with some black cohosh to see how that's going. But again, this is another one that does interact with a lot of prescription drugs, so it's important to make sure that your patients understand that and what that really means to them, and things that they should look out for, and why we have to have the complete picture of what it is that they're taking. Chamomile. Believe it or not, chamomile actually has over 22,000 different species, and they use it for many things from motion sickness, GI problems, gas problems, hemorrhoids, ulcers, but pregnant women should not take chamomile because it actually induces contraction. So this is something that they could take as they're at the end of their pregnancy, and some doctors recommend that they can drink some chamomile tea, but this is obviously when they're in 39 and 40 weeks of pregnancy. But early on, you don't want to have a pregnant woman that's, very in her first, second trimester drinking chamomile tea, because it can induce contractions. Chamomile interacts badly with anticoagulants, which I can tell you right now, almost every herbal natural supplement out there is going to interfere with anticoagulants like Coumadin and levo. I can't even think of the name of it off the top of my head. It'll come to me. Hold on, having a moment. Benzos, okay, CNS depressants, and chamomile can actually worsen asthma in certain cases. Feverview is another plant, and if you're looking in your PowerPoint, it's a pretty little plant there. It's got a pretty white flower, and for centuries they've used it for headaches, fever, arthritis, asthma, and GI upsets. NSAIDs can decrease the effectiveness of this herb. So not only do you have the risk of natural supplements interfering with your prescription medications, but you can have prescription or OTC medications interfere with the desired effect of your natural supplement. So that's something that needs to be taken into consideration too. If you're taking Feverview for, arthritis, but you're using NSAIDs on a daily basis, you're counteracting. So it's really not necessary to be taking both. Garlic. Garlic, we use in many different aspects, particularly in the kitchen. It's the most common herb used in the kitchen, but it's actually really got some good health benefits to it. They say that garlic is one of the best herbs or herbs to use in cooking for heart health. They can also be used for stress relief. They're seeing some anti-cancer properties to it, so as an anti-cancer agent, help with hypertension, colds and flu, and overall wellness. So one thing that I'm kind of journeying in right now through alternative therapies is I've been doing a lot of reading. Obviously, you have to be careful where you're getting your information from and following CDC guidelines and all of that. But prior to us kind of being on lockdown here, I was able to go to Costco, before the whole toilet paper disaster, and I picked up a couple bottles of multivitamins for adults and a couple multivitamin gummies for kids, and then I picked up a big 500 count bottle of vitamin C. So kind of thinking in terms of my health, my husband's health, my family's health, and those natural things. We have daily vitamins that they recommend that we take. We're not getting it in our enough in our daily diets, and then boosting our vitamin C intake is what we're doing right now. We're taking about 1,000 milligrams of vitamin C a day. I am not suggesting that you go and do this. I'm saying you should do your research and do what you're comfortable with, but just letting you know I've kind of gone this path as well, due to this virus, and kind of putting a lot of things into perspective of, really how good is my immune system, and, what things can I take that are going to be okay for me to take with anything else I may be taking, and help give me that natural or new, or, extended boost that we need. Ginger has over 1,000 species itself. It's most commonly used as an antiemetic. So, you'll hear a lot of people, especially older generations, will say, "Oh, you have an upset stomach, eat a ginger snap, or make some ginger tea, cook with ginger." A lot of people use that as well. It can be used to help treat malaria and cholera is one thing that they found is pretty effective for that. Obviously not by itself, but does help the immune response. And when I was pregnant with my last child, I had morning sickness very badly. It's called hyperemesis. And I even tried the ginger tea, and didn't go over so well, didn't work very well for me. But some people who have mild cases of, morning sickness, or sometimes they just have sensitive stomachs, it works really well for them. It does not interact well. So ginger does not interact well with barbiturates, blood pressure medications, cardiac drugs, and diabetic drugs. So those there are pretty critical patients, right? Any patients that are on top of cardiac drugs, blood pressure drugs, diabetic medications, these are chronic health conditions that we have to be sure that, they're taking their medications. These medications that they're taking, the prescription wise, are essential for treating, healing, curing, and maintaining life for these particular patients. So it's important to them to understand that, they can't just go out and grind up a whole bunch of ginger and consume it, because it can interact with those medications. Ginkgo biloba is referred to as a living fossil. That's how long it's been around. They've actually found it in fossils. It's used to treat poor circulation, asthma, liver function, helps increase memory. Some cultures use it for treating heart disease, regulating blood pressure. But again, do not take ginkgo if you have bleeding ulcers, epilepsy, or infertility. Ginseng, you probably have heard this a lot. Ginseng is also another form of natural occurring supplement that we have harnessed and made available for consumption. And they believe ginseng is used for overall health or wellness. They believe it's good for boosting the immune systems, helping with any inflammation. So if they're having an autoimmune disorder, it's an inflammation based, or if they're just having inflammation in general, they use it for depression, and then also as a diuretic. Golden seal is known as the buttercup family, and when you see the picture, you'll kind of understand why. They use it for GI problems, inflammatory conditions, painful menstruation, eczema, dandruff, and itching rashes. Hawthorn the treatment depends on what part of the plant is used. So hawthorn is one of those that multiple portions of the plant can be used. Some herbal supplements are just the roots, some are the flowers, some are different parts of the plant itself. And hawthorn actually has different parts of the plant that are used for different types of indications. So they can use these to increase blood circulation and help heart conditions. The purple cone flower is also known as echinacea. Echinacea has been around for centuries. Even the Native American population has used echinacea or echinacea since they've been around, and their medicine man or whatever, their healer, has been using it for centuries as well. So they use it as an immune booster to help treat colds and infections. The one thing that people have to understand is, so for example, we have a patient that has had an organ transplant. What is the one medication that they're going to be taking lifelong if they've had an organ transplant? Immunosuppressants, right? We have to take immunosuppressants, or our patients who have organ transplants have to take immunosuppressants, because if you stop or you're not taking immunosuppressants, the body's immune system recognizes that organ as a foreign invader because it's not our own organ. So we have to take medications to suppress our immune system so it does not attack and reject the organ. If patients are on immunosuppressant medications, they cannot take euthanasia because euthanasia increases the immune response. So it's counteracting the work of the immunosuppressant. Other names for euthanasia include black Samson, Samson root, excuse me, narrow-leafed purple coneflower, and the red sunflower. Milk thistle. Milk thistle, excuse my pups there. Milk thistle is not known currently to have any major reported interactions. And interestingly enough, they do use the milk thistle intravenously to treat mushroom poisoning. So, it's not safe to just go out into the woods and, pick a mushroom up off of the ground and eat it. Most of those are poisonous, and milk thistle is pretty much the only antidote to that in case that intoxication happens. There's St. John's wort. So wort means flower in Old English. Uses include improvement in sleep disorders, anxiety, agitation, depression, and fatigue. Should not be taken with other herbs that cause sedation or any antidepressants and anticoagulants. I challenge you to go into your large drug information handbook and just flip through different drugs. Open it up, pick a drug in A, pick a drug in B, pick a drug in C, all the way through the alphabet. And if you go to the portion where it talks about herbal supplements in the section of the drugs, most of them will list St. John's wort as an interaction. Valerian, typically this is the root of the plant that's being used. So the main uses for valerian are sleeplessness and depression. So you can find a valerian root supplement, like a capsule or powdered form, over the counter in any of these natural shops, Whole Foods, that type of thing, and they use that for sleep in most cases. Think about if we're using something to help us go to sleep, it has that drowsiness effect, depresses our respiratory system to allow us to calm down and go to sleep. Therefore, it's contraindicated or should not be used in conjunction with taking any alcohol, drinking any alcohol, taking any barbiturates, benzos, right? So Xanax, Ativan, diazepam or Valium, any of those, any other sedatives. Trazodone is a sedative. It's not a controlled substance, and a lot of people use trazodone for sleep. The other thing is melatonin. You can find melatonin over the counter as well, and a lot of people use melatonin for sleep. It's just you have to be very careful of how much of this sleep aid stuff you're adding on. Too many can cause you to go to sleep and not wake up. So things to keep in mind. Do not start out taking the full dose of an herb until you know how it will affect you. So we've talked about this. We will always want to ask our patients if they have any allergies, even if that patient has been coming for 30 years. Why? Because anytime we take something new, we do not know how our body is going to react, right? So if they decided taking a particular herb, it's recommended that they don't jump right into the full dose. They want to take a smaller dose first to see if they're even allergic to it or how their body's going to react to it. If you have a reaction to a herb, you should know all the herbs in that family because they can cause a reaction too. Think about the connection between penicillins and cephalosporins. They're similar, right, families. And so a percentage of penicillin patients also report an allergy to cephalosporins. This is kind of the same idea. If you or a patient are allergic to a particular herb, you need to know any other herbs that fall within that family and be aware of that because you could also have the potential of an allergy is there as well. Poison control, that's a good number to have around, not only if you have kids, but just in any situation. If you end up having an allergic reaction to something or an adverse effect, Poison control, unless it's an emergency, you call 911. But poison control is your good resource there to say, hey, I just started taking the supplement. This is what it is. This is what I'm having. And they're going to have the most up-to-date information there for you as well. Blends usually work better, and make sure the brand is a well-known brand. So we talked about this before, particularly in our law section as well for dietary supplements. If you're going to look for dietary supplements, and I'm going to grab a bottle here in just a second to kind of show you, you're wanting to look for ones that have the USP verified seal. And on that, it means that it has been USP verified. So these companies have voluntarily sent samples of their own medications, right, or their supplements to be tested to make sure that if they say I have 500 milligrams of vitamin C in here, that's what's really in there. So it's not a requirement. They don't have to do it, but I think companies that take that initiative to send their products over to the USP for verification, that just proves that they do have our best interest at heart, and that they're willing to say, yes, what I claim is on the label is actually what is in those capsules. So I'm going to go grab a bottle here real quick so you can see what I'm talking about. So we have Kirkland children's vitamins here. As you can see, my kids have been chowing down on these. But if you look right here, there's that USP seal. Okay, this is what we're talking about for dietary supplements. So it says dietary supplement USP verified. So Kirkland, who is the maker of these particular vitamins, which is Costco's brand, they have willingly and voluntarily sent their products to the USP for verification. So everything that is listed within this label here, so it says that there's 315 micrograms in one gummy. USP has verified that to be true because they have sent their samples over to be tested and ensured that whatever they're claiming on the label, how much of the ingredients are actually contained within that. I personally have made sure I only purchase anything like that over the counter with a USP seal. Again, because these things aren't regulated by the FDA, but this shows to me good faith from the manufacturers that they're willing to say, you know what, I'm going to show you that we have made a quality product. Herbal preparations. So there's different types of herbal preparations that come in different forms. You can have syrups and tinctures that can be taken internally. You have some that have alcohol bases, glycerin bases, or vinegar bases. So it's very important that you pay attention to whether the tincture is a topical tincture or if it's able to be ingested. And the syrups and tinctures are actually the most potent form of herbal preparations. There are tablets and capsules, again, which we would take internally. Most of them are powdered, meaning that the herb itself has been ground down into a powder. They've added inactive ingredients and put it into a tablet form or a capsule. These typically are slow to act because of the metabolization needed within the body. So it's just like if you take an oral ibuprofen. You don't get the effects of curing your headache right away. It takes 20 to 30 minutes because the ibuprofen has to go through the processes of within the body of being absorbed and reaching your brain or your headache or whatever you're suffering from and relieve that pain. Dietary supplements are no different. Teas, again, are something that are taken internally. They can be made from syrups and sweeteners. Typically, these teas taste better when they are sweetened, and these are stronger than tablets and capsules because of the liquid version. Aromatic solutions in baths, so these are external uses of herbs. So think about any type of herbal drops or bath bombs, those type of things that have like lavender and stuff in it that you take a bath in. You're not eating it, you're not consuming it, you're taking a bath in it. These are used for skin conditions and burns, and you do have an immediate reaction because it's coming in contact with your skin. Oils are also an external use. These are extracted from herbs, so essential oils. They can be rubbed on the skin. They can be used for skin conditions. And we also use some of these oils now in our oil diffusers, right, to do for our senses, okay? Compresses and salves. So these are also external. They're made from teas. Salves tend to be made from herbal oils. So typically what it is they have a cloak or cloth that is soaked in the herbal preparation or the herbal tea or whatever it is that they're using, and then applied directly to the site. So homeopathy is the Greek term meaning like, suffering. So it is believed that homeopathy is like treats like. Small amounts of a substance that cause a person's disease or condition will enable the body to fight off the disease. This theory has been around since the 1700s in Germany and around the 1800s in the United States. The FDA does oversee the manufacturing of homeopathic drugs, so they are pretty much categorized in the same category as OTCs. This is one thing that is absolutely imperative for you to remember and understand. Okay, so we have our FDA regulates, okay, and that's a little bit, well, hopefully it's not too bad. With the FDA regulates, they regulate prescription, which is our legend drugs, right? And then OTC and homeopathic. Those are the three entities, scoot over so you can still see it, the three items that the FDA does oversee, okay? Dietary supplements are not overseen by the FDA, just prescription or legend drugs, over the counter, and homeopathic. There's a National Center for Homeopathy, and most of the homeopathy agents are actually available over the counter. There are different practitioners that oversee treatments using homeopathy. So they have the Diplomat of Homeopathic Academy of Naturopathic Physicians. So there's actually a school that is not in the United States. I believe it's in Nevis, which is a tiny island, that these practitioners can go to learn how to become a doctor specifically in homeopathy. And that's it. All right. So again, I just want to remind you, you have two discussion boards. You have one for chemistry and one for pharmacology. Some of you are participating in one and not both. You need to make sure that you're both in there, in both of them, and participating. Complete your daily assignments. Again, these are YouTube videos, so I can see I can see how many views there are, and I know how many students I have in class. So be sure that you're watching these. I think this will be so much more helpful in addition to viewing the PowerPoint and reading the chapters. Again, I'm here if you need me. I've been consistently checking my emails, not only from 8 in the morning to 5, but well into the evening until I go to bed. So if you have any issues or questions, email me right away, and keep doing a great job, and we'll see you in the next video.